People in the world, it's been estimated, are currently experiencing depression. And according to the World Health Organization, depression is the largest contributor of global disability, which means that it's one of the primary, if not the primary, source of struggle on the planet in terms of health consequences. Now, what's interesting and heartbreaking is that rates of depression are dramatically increasing, particularly in the United States. But what's interesting is that this increase in depression appears to be specific to young individuals between, say, the age of 12 and 27. It's a complex figure, but what I really want to highlight is the fact that there's this spike in depression, and this appears to be particularly in younger generations. So this is clearly an important health focus for our current society as well. So, what is depression? There are current medical systems, diagnostic systems that define depression in a very particular way. And importantly, what these systems say is that depression is not sadness or just sadness. It's not having just a bad day. It's a sustained and prolonged loss of interest in life and or really profound sadness that goes on for an extended period of time and then really has a negative effect on somebody's life and family. It's also not just one symptom or experience, it's a group of symptoms that come together to create the experience of depression. Some of these symptoms include excessive sleep or loss of sleep. Difficulty focusing or concentrating or remembering particular life events. very low self-esteem, feelings of what we would call in the West worthlessness and really feeling bad about yourself.
아니 수수수를 통 매번 차니 와 아니 수수를 리탕 가에 모토네 다음에번 디데기가 상로 용돼야.
And symptoms of suicidality or the urge to take one's own life.
다음에 아니 수수수를 따지기로 시작돼 와 소진되기 상로기 양양 용돼야.
Now, importantly, these ideas of depression were defined in American or European contexts.
그 개체 부지가 안데 디프레션 문제 지나다 기준도 샤야기 또 아메리카다 유럽이 아니 디션디 시송이 지고레스.
So, if you're thinking about depression in the context of a Tibetan group of individuals or in yourself as a Tibetan, there may be nuances that are unique to your experience or to your culture or to your family that are important to be aware of.
지난달 안쪽에 아니 베베 지속이나 올라 이모 약간 도다 수술기 아니 지금 영명이 더니 이모가 상담 바이나 실제 체크에 용식이 됐어요. 그 자외 건조기 내가 샤바 디다 민자와 제발 친구들이 영주를 했어요.
So, what causes depression?
원하다디 가리기 아니 유치에 디게가 됐어요.
Many things. Many things come together in a complex way, each contributing a small amount of contribution to generate the complexity and the kind of dynamic components of depression.
슈게임 무슨 친구 제네 근데 상황 소유도 딱지게 가서 디프레션이 라야지다 이게 아니 디프레션 스테이트 수지 기능性 친구이거나 뭐 주제도 보면서 이거디 저기도
There's evidence that stress, particularly during the early days of life, in the early years of life, generate risk for depression, including stress in the prenatal environment biologically.
냠식이 이 밤다 파지 가르치기로 했으라바이나 나서 생년이와 스트레스 이 타고도 충류 스트레스 만큼 용해야다 아메니에나 리유에 갑수 스트레스 용어디기 아니 디프레션 롱디어디 감다요 그래서.
Another period where stress is particularly dangerous for generating depression is during the period of adolescence, and one of the stressors that have been shown to generate risk for depression during adolescence is social isolation.
얘네가 보면서 인생 상황이 나로로 뒤수 내가 친구와 스트레스디 이모야 왕야게 뒤수 내가 친구 찍기 바랬으라고이나 adolescence라 나만형이 그러고 주소네 저게 디바나 아니 그거요 레스 학벌도 되게 생일이 아니 총매 해양 내야 그러 신바기가 수술 제가 맞으려면 해양내 되게 용도 스트레스 딜라테네 이모랑게
Behavioral factors can drive depression, including high-fat diets and excessive use of drugs or alcohol.
다른 시간도 군주나 대화 자기요 레스 베네차샤바이나 세데라 카드 샥지 토부유겐기 카라 고데야 야나 아니 창라라 소베 뮤제릭네 무즈게 디프레션 공시레스.
Medical illnesses.
아니 네 나자기 예시레스.
And notice that the last point I'm mentioning is genetics, because from my perspective, yes, genetics do play a role, but they play a fairly small role when you take into consideration the many factors that come together to generate depression.
내가 타마델라 아주 리제기 수수기 리제기 엔진에 용도레스 이네디 야나프랑기 뜻이 손셰바이나 리제기 엔진이 아니 차충주지 디 마인베 제 마인베 게 망고시우지 여가 건조기 다슈게 신부여디 되게 상가 내가 프랑타 수디
And I think that's important to challenge the kind of determinism, genetic determinism, and sometimes the stigma that can come from depression, just thinking it's wired into people's genes. There's compelling evidence that that's not the case.
the Tapena Lizeti, any Kansas Soji of Position, the Layanko, Shenchayores, Nekayores, Kaisana, Ranski, Zipran, Lola, the depression Naya, the Yores, Lavaina, the Chekame, Sorakani, de la Migi, Chisol, Mene, de la Tahan, Nepoimia, of the day, we were Santa for Zeki Kansas, Yunayaki, Cheshire.
In fact, the more I study the biology of human experience, the less convinced I am that genetics play a very large role. I view human neurobiology and biology as very dynamic and very amenable to life changes and life experiences.
That meeting also genuine get ham da, any cover to any wangza, Jave, we get ham to Sugi, any Chawashana, the Zoo,
I've limited time, so I'm going to just say a word or two on the work that we do and others do by examining on brain systems that are involved in generating depression. And just because I'm talking about the biology of depression does not imply that I'm suggesting that these brain profiles are genetically determined.
Depression that they
To simplify, and you may have seen this figure of mine before, I think we can consolidate the emotional brain into a few pillars.
That can teach in the party see the number of them also Karsore, Semyon and David, Level the Shijan do, Kawas become the
These are brain systems that involve processing threats in our environment, brain systems that are involved in facilitating reward behaviors and approaching things that we want in our environment, and brain systems in the prefrontal cortex that help manage attention and regulate our emotions.
The Kawas the Kares Lavaina, Chiki, Maransugi, social like Yanga. Not the zoo, any Chume Kausu, any Chiki, Chawachi, Leve Malachi, and it's Chiki, social Pendo, you gave it up to the Kela, the Chume Kausu, and the Tenzin, Chiki, Malachi, and Tene Chiki, and the late Gasopa, Maransugi, Zinda, there was some brother, there were attention that was that they Malachi to some rest.
There's a lot of research. My lab is working a lot on this these days to suggest that depression is characterized by heightened activity in threat systems.
The Galapan depression to Cheval Namrola, the depression to Mahui go at the Namrola, any depression, long air, depression to use that they Malaki Namrola, threat in Yangaki, yesterday Malashola, they went to Chuja to China, Mamule, you were
making people very sensitive to threatening stimuli in their environment, really monitoring the world for threats.
The Mala, the Chupu Chadi, Korean and Roland Institute of the Chumada and the Yangatone,
Another kind of brain profile that's frequently observed in depression is reduced activation in the brain's motivational system, which often corresponds with reduced interest or pleasure in life. And there's also evidence that depression involves reduced activity or reduced optimal activity in the prefrontal cortex involved in helping us manage our emotions.
릴레이기 아니 차시도 나로다야 내가 제 용도로네 디 로바디게 아니 가르치게 됐다 바이나 생명도 당시지야 이모션 레귤레이션이 아니 용도에 그래서
A brain system that's probably the most affected by mental health problems, including conditions of aging like Alzheimer's or neurodegeneration, is a brain system that's involved in consolidating our memories.
더 생기 나사 레지 베이나야 생기 나사 레지 베이네 디기 슈긴 셰슈 텍사 아니 직디 가르에서 바이나 노슬레베 나로라 쳔바단 데베 네베 차시 차리 어레스
And this may help explain why people with depression often have memory problems.
디라 데네 아니 지 이모 나사 유겐도 아니 쳔바 따지 쳔마토야 따는 쳔바 지게 요차야 따디 아니 제시 자투 그레스
So next I want to focus on what we can do. Top, you didn't see the photo, so. Next I'd like to focus on flipping the coin and recognizing that this is an actually optimistic story.
데네데 마주 제가 보라기 장도마스나 장바디 알로지 야메 아니 데바이나스 디야 마란소 세마르레 발레티 가지 그레스
Because as I suggested, I don't see biology or psychology as fixed, and there's substantial evidence that people can get treatment for depression and that those treatments have really positive effects on reducing depression and positive effects on the mind and body.
디 타그레스나 바이나 아니 디프레션도 데베기 아니 팅응기 차바는 상관이 야 생각이 차바는 상관이 있나요? 고 딜라 아니 민주주의 요거지나 죄 요거지나 아니 저거 아니 민주 템버 디기 통해 고 아니 자기 약도 줘야 어디게 나가서 가서를 해와 시사 요거지 그래서
There is a substantial amount of evidence that the wisdom tradition of Buddhism and meditation has really remarkable effects on helping people who struggle from depression.
다다디 이모 나사로 소거들이 나디게 두술라 아니 라즈 남베게 따로종기 탐남레 상도나다 두주기 아니 펜도 유요바 디라 따방다 할레 방구요레스.
And when I was looking for a picture to capture this, I couldn't help but showing one of my favorite pictures in the room, Geshe-Taki, who was sitting on a glass platform at the top of the Sears Tower in Chicago when he was with us a few years ago.
디 아니 다 제네 게마프란 다 파티 인트로듀스 총선스 파티 다 프랑가 슈츠 다 파티 is and the Chicago 나로다 아니 강제 토부슈지 나온다 샬라디 셰기 샬라지나 아니 시카데 슈데 파티스.
There are many forms of psychotherapy that are actually grounded in mindfulness therapy and meditation and Indo-Tibetan traditions that are emerging in America. And I will say, as a psychologist, we are very grateful for the wisdom tradition that you have because it's having very positive effects on helping people with depression.
제가 생함 이 가설에 주탑스로와 이 남로라 아니야 최근에 시작이 나오는 토네 주탑들의 아니 카지기 생기 나자다 디프레션 무술라 빙기요지 답도 신주도 보내게 와 인데게 주탑도 아니 관이 용바레스타와이나 아나란소 답이 남베기 아니 프로정다 수기 탑담이 용바레스 팀보스다 디게 리숑 디게 아니 잡을이 비망부시 부지라다 또 이거밖에
This is just one of numerous studies that have shown that training in meditation has positive effects on brain areas that are implicated in depression.
다다디와 아니 몸나 속에 자반예샤로 속에 몸도 제발라 되네 아니 이무단 제외 디프레션다 제외 레벨 차크만 고치라 또 예바디 아니 신주디게 통 등기요 레스 아니 데 신주 딱 망부시오지요 레스.
I'm going to be very brief on this last point because I want to turn over to Geshe-Taki.
다마기 텐센 딜라가나 수시라 디기메스 아니 아기스타딜라 제나야 유미스.
But in addition to meditation and contemplative practices, there's other forms of treatment that also show to be very effective for treating depression.
다 본다 다 본루기 아니 냠네 두주 마인베 야 디프레션 주의하게 담람식과 카지고 레스트 주기에 디프레션나 폐기요가 레스트.
The research suggests that psychotherapy or mindfulness types of training are as effective, as if not more effective, than medications. So I think it's oversimplified to think that medications are the only treatment. In many respects, behavioral interventions are more effective.
So that this again psychotherapy semkam samrodana didik chethap chwa di ani shinju mangdu di chethap di halam men da men le thada men ne nyambe ani yugo chigi yoba di shinju mangdu di te yores.
There's substantial work that arguably the best thing that one can do for their brain is aerobic exercise. And the biggest effect that aerobic exercise has on the brain is the hippocampus, which is the area of the brain that's most affected by depression.
Then 다른 시 단단한서 유세기 톤에 학벌도 다 에로빅스 라이브 가수래가지고 우기 다 우정라서 데 유세기 데벨롭먼트 요바다 학벌도 제과도 제외 레벨이 자신도서가 쉬워지다 도 요바니 되어요.
And there's also evidence that medication and other more kind of forward-thinking treatments like neuromodulation also can really help people who are struggling with depression.
다른 시대 주도 심바 카지기에 디프레션 주가 비야 변화샤샤바이나 neuromodulation스라니 개가 레벨이 자신도가 아니 로로 마타니 요가다에 주기에 또 예쁘대요. 그래서
So I'd just like to close my comments by where I started. Which is to say, it's a real honor for me to be here talking about something that's so personal to our family, amongst friends like yourself. And I'll say that when I'm in my dark days or dark moments, I look often to the wisdom tradition that you study and that you bring to my life, and I just want to say how grateful I am for how much I've learned from you, and I'm continuing to learn from you as I help try to manage my own mind and navigate my own emotions. So thank you so much.